Hello everyone, today's presentation is about food allergies. Our team is composed of Juan Manuel Pérez Rosas, María José Ramírez Basilio, and me, José de Jesús Olmos Limón. First of all, I would like to introduce you to this presentation with a definition of what food allergies are. Food allergies are adverse health effects arising from a specific immune response that occurs reproductively on exposure to a given food. They can be categorized into non-IgE mediated and IgE mediated, which are the most common ones. Now let's move on to common food allergens. The most common food allergens include milk, eggs, peanuts, tree nuts, fish, shellfish, wheat, and soy. Now we pass to causes and risk factors. In causes, we have genetic predisposition, environmental factors like early exposure, and autoimmune response. In risk factors, we have age, family history, other allergies, asthma, personal history, and certain medical conditions.
Well, now we pass to the part of symptoms and reactions. First of all, we have the mild symptoms. These ones are the first that occur when you have a contact with something that is allergic to the person. Some examples are hives, like the urticaria, itching, like pruritus, digestive issues, like nausea, diarrhea. We have another ones like respiratory ones, in the throat. We have a lot of symptoms, but these ones are the most common. Then we pass to the severe symptoms that these ones are life-threatening. So we pass to the part that the anaphylaxis. The anaphylaxis symptoms and signs, first one are the throat swelling, difficulty breathing, drop in blood pressure. And this part is really important because if we don't treat these symptoms, we can go to the death of the person. So we have in this part that we have acute and delay symptoms. Acute, as the name said, is at the moment is typically occur within minutes to hours after the exposure to the allergen. So it's like really quickly and are the mild symptoms. And we have also the delayed that can occur hours to days after the exposure to the allergen. These ones are not too bad like the acute ones, but well, we have to treat them. Now for the part of diagnosis and testing, well, first we have that those involves identifying specific allergens that trigger immune responses in individuals. Various tests and procedures can help pinpoint the allergens responsible, guiding effective management and treatment strategies. Okay, with this, we have three different ones that are the skin tests, the blood test, and oral food challenges. The skin tests are really simple, actually. You only put the allergen in the skin of the person, and sometimes are those in the forearm. So obviously with a medic there. So a small amount of the allergen extract is placed on the skin. The skin is pricked or scratched, and through the drop, allergen is extract. And with this, we can say if it is positive or negative. Then the blood test, we only measure levels specific of IgE antibodies, and if it is rise, we have a positive test. And the oral food challenges, well, as the name said, we gave the food to the person, and if we saw a reaction, this is positive. Now, for the management and treatment, this is all actually really easy. First of all, avoidance of allergens. If we know that the person is allergic, pues we have to identify allergens, reading food labels to see if the allergen is not present in the food that the person is going to consume, and obviously environmental control for the people that is allergic to dust and humidity and whatever. Well, the principal treatment is the epinephrine. We have epinephrine auto-injectors for the people that are most commonly in contact with the allergens. These are essential for the emergency and for anaphylactic shocks. We also have antihistamines and corticosteroids to treating and to relieve the symptoms, and obviously the patient education for try to avoid these circumstances.
When living with allergies and want to go out to eat or travel, or when going to school or work, it's important to do prior research of the menu, carry an allergy card, notify the restaurant staff, have a travel research, we award which food causes you an allergy to avoid it, and take a treatment if you have one. It impacts the quality of life, sometimes generate anxiety, stress, and social isolation due to not being able to consume some foods. It implies a change in a food and diet, as well as implies a challenge in social activities when they only offer some food to which one is allergic and the only thing you can do is not eat it. People with allergies and their family members should receive support through food allergy research and education, which offers training to eat correctly by changing those foods for others that provide the same energy value but don't cause allergies. It's also necessary to have an emergency plan in case of having an allergic crisis.